Gentlemen, let's talk honestly today, especially those of you over 60. This is a subject many men think about, but very few talk about openly: masturbation. And the first thing I want you to hear clearly is this: it is normal, it is human, it does not expire with age. But here's the part that doesn't get discussed enough. Your body at 60 is not the same body you had at 25. The tissues are different. Blood flow changes. Nerve sensitivity shifts, skin becomes thinner. Recovery slows down. So while the act itself is still natural and often beneficial, the way you do it matters much more now. Today, we're going to break this down properly. No shame, no meths, just clear, practical, science-based guidance about how to masturbate safely after 60 and the 3 biggest mistakes men make that can quietly cause problems over time. And yes, this is about pleasure, but it's also about prostate comfort, tissue health, circulation, and protecting your long-term sexual function. Let's start with something important. As men age, erections often change. They may not be as firm. They may take longer to develop. Refractory time increases. That's normal physiology. Testosterone gradually declines. Blood vessels stiffen. Nerve signaling slows slightly. None of that means you're broken. It just means you have to work with your body, not against it. Now let's talk about why masturbation can actually be beneficial after 60. Regular ejaculation may help maintain healthy prostate fluid turnover. Some research suggests it can reduce pelvic congestion and may support prostate comfort. It can relieve stress. It can improve sleep. It can help maintain erectile tissue responsiveness by encouraging blood flow. But the benefits only happen when it's done safely. And this is where I see problems. Mistake number 1, not using lubrication. This is the most common issue I see in older men. As you age, skin naturally becomes drier. The penile shaft and glands lose some elasticity. The microvascular tissue becomes more delicate. When friction is applied without adequate lubrication, tiny microtears can occur. You may not even see them, but you can feel the irritation later. Over time, repeated friction without lubrication can contribute to inflammation. In some men, chronic inflammation combined with minor trauma has been associated with scar tissue formation, and scar tissue in the penis can sometimes lead to curvature or discomfort during erections. The solution is simple but powerful: use lubricant every time. A good quality water-based lubricant is safe, easy to clean, and gentle on sensitive skin. Silicone-based lubricants last longer and are especially helpful if you notice significant dryness. If you have very sensitive skin, look for fragrance-free, glycerin-free options. Apply more than you think you need. There is no prize for toughing it out. Friction is not strength. Protection is strength, and reapply if needed. After 60, lubrication is not optional. It is protective medicine. Now let's move to mistake number 2, using excessive force. Many men developed habits in their teens or 20s where firmer pressure seemed to equal stronger sensation. But aging erectile tissue does not respond well to aggressive squeezing, twisting, or bending. Inside the penis are 2 chambers called the corpora cavernosa. These fill with blood during erection. They are surrounded by a fibrous sheath called the tunica albuginea. When you apply excessive pressure or bend an erection forcefully, you are placing stress on that sheath and the blood vessels inside. Over time, repeated stress can cause bruising, inflammation, or nerve irritation. Some men notice temporary numbness. Others notice soreness that lasts for days. In rare but serious cases, aggressive bending can cause penile injury. And here's something important: overly tight grip habits can condition your body to respond only to intense stimulation. That can make partnered sex feel less stimulating over time. So what should you do instead? Slow down. Use a lighter grip than you think you need. Focus on sensation, not speed. Explore varied pressure instead of constant force. Let arousal build gradually. At 60, erections may take longer, and that is perfectly fine. And when you rush the process, you're more likely to force stimulation before the tissue is fully engorged. Gentle rhythmic motion is safer. It allows blood to flow naturally. It reduces tissue stress. It protects nerve endings. If something hurts, stop immediately. Pain is not something to push through. Pain is information. Now let's talk about mistake number 3, ignoring hygiene afterward. After ejaculation, residual semen and lubricant can remain on the skin. In warm, moist environments, especially men with diabetes or enlarged prostate issues, bacteria can multiply more easily. This increases the risk of skin irritation, balanitis, urinary discomfort, or fungal infections. The solution is simple. After you're finished, wash gently with warm water. If you use soap, choose a mild fragrance. Free cleans are designed for sensitive skin. Avoid harsh antibacterial soaps. They can disrupt natural skin balance. If you are uncircumcised, gently retract and clean underneath, then dry thoroughly before replacing the foreskin. Moisture trapped under the foreskin can contribute to irritation if left sitting for hours. Dry carefully but gently. Do not rub aggressively. This small habit dramatically lowers infection risk. Now I want to address something deeper. Frequency. Men often ask you, how often is too often? There is no universal number. What matters is how your body feels. If you notice soreness, fatigue, persistent pelvic discomfort, or decreased erection quality, consider spacing sessions further apart. For some men, once or twice a week feels good. For others, more frequently thickies recovery. At 60, recovery takes longer. If you stimulate again before tissue fully recovers, irritation risk increases. Listen to your body, not to myths. Now, let's talk about prostate health briefly. Some men believe ejaculation prevents prostate cancer. The evidence is mixed. Some studies suggest a correlation between frequent ejaculation and lower prostate cancer risk, but this does not mean masturbation is a guaranteed protective strategy. What we can say more confidently is that regular ejaculation may reduce pelvic congestion and can support prostate fluid circulation, but it is not a substitute for proper screening. If you're over 50 or earlier, depending on family history, talk to your healthcare provider about prostate exams and PSA testing. Masturbation supports comfort. It does not replace medical care. Next, erectile changes. After 60, blood vessels become less elastic. Nitric oxide signaling, which helps erections occur, may decrease. That means erections may be less rigid or may fluctuate during stimulation. Do not respond by squeezing harder. Instead, focus on arousal, mental stimulation, relaxation, deep breathing, good foreplay with yourself. Anxiety tightens blood vessels. Relaxation improves blood flow. Sometimes difficulty maintaining erection during masturbation can signal early vascular disease. The penile arteries are smaller than coronary arteries. Erection changes can appear years before heart symptoms. If you notice persistent changes in firmness, speak to your healthcare provider. It could be a window into your cardiovascular health. Now, let's talk about diabetes. Men with diabetes are at higher risk for nerve damage and reduced sensation. They're also more prone to infections. For these men, lubrication and hygiene are absolutely critical. Additionally, inspect the skin regularly. Look for redness, cracks, sores, or changes in color. Reduced sensation means you may not feel minor injuries right away. Prevention is much easier than treatment. Another important factor is medications. Many men over 60 take blood pressure medications, antidepressants, or prostate medications. Some of these can affect erection strength, ejaculation, or libido. If you notice significant changes after starting a new medication, discuss it with your provider. Do not stop medications abruptly, but adjustments are sometimes possible. Now, I want to address a psychological piece. Some men feel guilt about masturbation in later life. Cultural messaging can suggest sexuality belongs only to the young. That is simply not true. Sexual health is lifelong health. Pleasure is part of quality of life. But mindful pleasure is the goal, not compulsive behavior. Not aggressive stimulation, not ignoring discomfort. Mindful. Let's review the 3 biggest mistakes clearly. 1. No lubrication. 2. Excessive force. 3. Poor hygiene. If you fix those 3, you dramatically reduce risk. Now, let's go deeper into technique adjustments that support aging physiology. Start slowly. Allow full arousal before increasing rhythm. Use your whole hand instead of just fingertips. It distributes pressure more evenly. Change positions occasionally to avoid repetitive strain. Avoid bending a fully erect penis sharply. If you use devices, ensure they are body-safe materials and clean thoroughly after every use. Never use vacuum devices without proper guidance. Improper use can cause bruising. If you experience pelvic pain after ejaculation, dull aching between the scrotum and rectum, it could be pelvic floor tension. Gentle stretching, warm baths, and relaxation exercises may help. Persistent pain requires medical evaluation. And please understand this clearly. Bleeding is not normal. Severe sudden pain during erection is not normal. Persistent curvature that develops suddenly is not normal. Numbness lasting days is not normal. These require medical assessment. Early treatment prevents complications. Now, let's talk about overall lifestyle. Good erectile health depends on good vascular health. Exercise improves circulation. Balanced diet supports endothelial function. Adequate sleep regulates hormones. Managing stress reduces cortisol, which can interfere with sexual function. Limit smoking. It damages blood vessels. Moderate alcohol. Excess alcohol reduces erection quality. Sexual health is not isolated from general health. Your penis reflects your heart. Finally, communication. If you are in a relationship, masturbation does not mean something is wrong. It can coexist with partnered intimacy. In fact, understanding your own arousal patterns can improve communication and connection. There is no age where sexuality becomes inappropriate, but there is an age where wisdom becomes essential. After 60, your body deserves gentleness. It deserves lubrication, it deserves hygiene, it deserves attention, and most importantly, it deserves respect. If you ever experience ongoing pain, changes in ejaculation, blood and semen, urinary symptoms, or erectile difficulties that persist for months, seek evaluation. Silence delays solutions. Men's health thrives on awareness. So let me leave you with this. Masturbation after 60 is not dangerous, but careless habits can be. Protect your tissue. Use lubrication generously. Choose gentle technique, clean thoroughly afterward, monitor changes, and seek help early if something feels off. A healthy sexual life in your 60s, 70s, and beyond is absolutely possible. It just requires adaptation. Stay informed, stay proactive, And take care of your whole body because sexual health is not separate from overall health. It is part of it.